You're looking at these faces, and you probably think they've had too much plastic surgery. But the truth is, not all of them are what you think. Pause. Some have spent over $1 million changing their bodies. Some have gone through 30, 50, even hundreds of procedures. But others haven't had nearly as much done as it seems. Slower tone. In this video, you're about to see some of the most extreme transformations ever. From massive breast augmentations and multiple BBLs to faces that are almost unrecognizable. Drop tone, suspense. But what might shock you the most is this. Pause. The line between real surgery and visual illusion is way thinner than you think. Close strong. And some of the people in this video might completely change the way you see beauty. Alicia Amira's transformation reflects a deliberate and ongoing approach to cosmetic enhancement, shaped by multiple procedures over time rather than a single defining change. One of the most prominent aspects of her appearance is her breast augmentation. She reportedly increased from a naturally small size to significantly larger implants, estimated at around 650 cubic centimeters or more. Her surgical journey has not been without complications, as reports indicate that she experienced issues such as hardening in one breast, potentially linked to infection. Despite this, she continued to pursue additional revisions to refine the results. In addition to surgical procedures, Alicia has made extensive use of non-surgical treatments. Dermal fillers have been applied to the lips, cheeks, nose, chin, and jawline, contributing to a fuller and more sculpted facial appearance. Botox has also been used regularly to maintain smooth skin and reduce the visibility of fine lines. These treatments have been repeated over time to preserve what is often described as a doll-like aesthetic. Her transformation also includes rhinoplasty, with adjustments made to create a narrower and more elevated nasal profile. More broadly, multiple areas of her face, including the forehead, eyes, cheeks, and lips, appear to have been refined through a combination of surgical and non-surgical techniques, resulting in a highly stylized overall look. Beyond the face, Alicia has undergone body contouring procedures, such as liposuction in various areas. She has also expressed interest in more extreme interventions, including a Brazilian butt lift and rib removal to achieve a narrower waist. However, some of these requests have reportedly been declined by medical professionals due to their high-risk nature. Allegra Cole's transformation is most notably defined by her repeated breast augmentation procedures, which were carried out over time rather than as a single decision. She reportedly began with implants in the range of 700 to 800 cubic centimeters, but continued to increase their size through multiple interventions. In addition to surgical enhancements, she utilized tissue expanders, allowing for gradual enlargement by adding volume over time. This approach resulted in an unusually large final size, estimated between 600 cubic centimeters, with a combined weight of over 20 pounds. What distinguishes her case is not only the scale of the augmentation, but also the method, combining surgery with ongoing expansion to reach a specific aesthetic goal. However, such extensive modification has been associated with complications. Reports suggest that her breasts developed noticeable asymmetry, with one side appearing firmer and positioned higher than the other. These outcomes are commonly linked to repeated procedures and rapid increases in size, both of which can place significant stress on surrounding tissue. Beyond breast augmentation, Allegra has also undergone body contouring procedures. She is said to have had at least 2 Brazilian butt lift surgeries, aimed at creating a more pronounced contrast between the waist and hips. In addition, she has undergone a tummy tuck, which helps flatten the abdominal area and further emphasize an hourglass silhouette. Her overall appearance has also been maintained through non-surgical treatments, including dermal fillers, Botox, microblading, and laser procedures. These methods contribute to a more defined and polished facial look, complementing the broader transformation of her body. Amanda Ahola's transformation reflects a gradual and intentional approach to cosmetic enhancement, shaped through multiple procedures over time rather than a single defining change. One of the most significant aspects of her journey has been repeated breast augmentation. She reportedly began with a smaller natural size and increased it progressively through several surgeries. However, this process was not without complications. At one point, she experienced a serious post-operative infection that required hospitalization, marking a notable turning point in her experience with cosmetic procedures. In addition to surgical interventions, Amanda has made consistent use of non-surgical treatments. Dermal fillers have been applied to areas such as the lips, cheeks, and chin, contributing to a fuller and more rounded facial appearance. Botox has also been used to maintain smoother skin and reduce the appearance of fine lines over time. These treatments have been repeated to preserve a look often described as doll-like, with soft contours and enhanced volume. Her transformation also includes rhinoplasty, with adjustments aimed at creating a more refined nasal shape, including a higher bridge and a slimmer profile. More broadly, several areas of her face appear to have been modified through a combination of fillers and minor aesthetic procedures, resulting in a cohesive and stylized appearance. There have also been mentions of additional procedures she may have considered. However, not all of these have been clearly confirmed, and some details remain based on reports rather than verified information. Blondie Bennett's transformation reflects a carefully constructed image built over time through a combination of surgical and non-surgical enhancements. One of the most defining elements of her appearance is her repeated breast augmentation, rather than a single procedure. She has undergone multiple surgeries to increase size, resulting in a noticeably large bust that has become central to her public identity. In addition to surgical changes, Blondie has made consistent use of cosmetic injectables. Dermal fillers have been applied primarily to the lips and cheeks, creating a fuller and more rounded facial appearance. Botox has also been used to maintain smoother skin and minimize visible lines, contributing to a more polished and youthful look over time. These treatments have been repeated to sustain a stylized aesthetic often associated with a doll-like appearance. Her facial transformation extends beyond individual treatments. By focusing on enhancing lip volume and softening facial contours, she has achieved a look that appears less angular and more rounded overall. This effect is the result of combining multiple techniques rather than relying on a single procedure. Beyond medical and injectable treatments, Blondie has also relied on non-surgical methods to reinforce her chosen image. These include tanning and heavy makeup, both of which play a significant role in shaping her overall presentation. Perhaps the most unusual aspect of her journey is her reported use of hypnotherapy. She has stated that she pursued hypnosis with the goal of aligning her mindset with her appearance, aiming to feel and behave more like the persona she was creating. Elena Starr's transformation is often described as the result of an unusually high number of cosmetic procedures carried out over time. According to various reports, she has undergone more than 500 aesthetic treatments, with total costs estimated to range from approximately $150, 000 to over £200, 000. This places her among the more frequently cited examples of individuals who have pursued repeated cosmetic modification on a large scale. A significant part of her transformation involves body-focused procedures. She is said to have undergone multiple Brazilian butt lift surgeries, estimated at least 3 to 5 times, with the goal of creating a more pronounced hourglass figure. In addition, she has reportedly had at least 2 tummy tuck procedures, which help flatten the abdominal area and enhance the contrast between the waist and hips. Her approach to body contouring also includes corseting procedures designed to reduce the waistline. These interventions are generally considered more extreme, as they aim to reshape the body's proportions rather than simply enhance them. Facial changes have also been part of her overall transformation. Reports suggest that she has undergone rhinoplasty, along with the use of silicone or dermal fillers in the cheek area. These treatments contribute to a fuller, more defined facial structure often associated with a stylized, Barbie-like appearance. However, her experience has also included serious risks. She has reportedly suffered from severe infections, including sepsis, and at one point required emergency medical care due to complications such as bleeding. These events highlight the potential medical consequences associated with repeated and extensive cosmetic procedures. Haley Lane's transformation appears to be shaped primarily by non-surgical cosmetic treatments rather than extensive surgical intervention. The most noticeable changes in her appearance are often associated with the use of dermal fillers and Botox. Fillers are believed to have been applied to areas such as the lips, cheeks, and chin, contributing to a fuller and more defined facial structure. Botox, commonly used to smooth the skin and reduce the appearance of fine lines, likely plays a role in maintaining a more polished and youthful look. Together, these treatments can significantly alter facial proportions without the need for major surgery. Beyond individual procedures, her overall facial appearance suggests a broader approach to aesthetic refinement. Her features appear more volumized and contoured over time, which may be the result of repeated filler use combined with cosmetic contouring techniques. This combination contributes to a stylized look, often described as glamorous or doll-like, emphasizing smoothness, symmetry, and enhanced definition. There has also been some speculation regarding a possible rhinoplasty, based on subtle differences in the shape of her nose in various images. However, there is no clear confirmation from Haley Lane herself, and such observations should be considered unverified. In terms of body-related procedures, there is limited reliable information. While some sources suggest the possibility of minor body contouring, there are no confirmed details available. It is also important to note that non-medical factors play a significant role in her appearance. Makeup, hairstyling, lighting, and the use of filters can greatly influence how features are perceived, often enhancing the contrast seen in before and after comparisons. Jennifer Pamplona's transformation reflects a long-term commitment to cosmetic enhancement, shaped by numerous procedures over time rather than a single defining change. According to various reports, she has undergone more than 20 to 30 surgeries, with total costs estimated at over $600. 000. This level of investment has made her one of the more widely discussed examples of extensive aesthetic modification. A significant part of her transformation involves body contouring procedures. She is reported to have undergone multiple Brazilian butt lift surgeries, estimated at least 2 to 3 times, in pursuit of a more pronounced hourglass figure, often compared to the body proportions popularized by celebrities such as Kim Kardashian. In addition, she has had repeated breast augmentation procedures, gradually increasing size and refining shape over time. Her body-focused changes also include liposuction in areas such as the abdomen, waist, and back, helping to create a more sculpted silhouette. A tummy tuck has further contributed to a flatter abdominal profile and enhanced waist definition. Facial enhancements have also played a key role. She has used dermal fillers in the lips, cheeks, and chin, along with Botox to maintain smoother skin. These treatments have contributed to a fuller, more defined facial appearance, often described as glamorous or doll-like. Rhinoplasty is also reported, with adjustments aimed at creating a higher nasal bridge and a more refined shape. However, her journey includes an important turning point. She has shared that she experienced health-related concerns following some procedures, which led her to reconsider her approach. Over time, she chose to stop and remove certain enhancements, including fillers, moving toward a more natural appearance. Clara Lima's transformation is often described as one of the more extensive examples of long-term cosmetic enhancement. According to various reports, she has spent over $1,000 000 on aesthetic procedures, beginning her journey in early adulthood, around the ages of 19 to 21. This level of investment has placed her among the more widely discussed cases in media coverage of cosmetic transformation. A central aspect of her appearance involves body-focused procedures. She is reported to have undergone approximately 3 Brazilian butt lift surgeries, with the goal of creating a more pronounced and sculpted figure. These procedures are commonly associated with enhancing curvature and increasing the visual prominence of the hips and lower body. In addition, Clara has reportedly undergone at least 4 breast augmentation surgeries, rather than a single adjustment. These procedures appear to have been performed progressively, with size increases and refinements made over time to achieve a specific aesthetic outcome. Her overall body transformation may also include procedures such as liposuction and other contouring techniques, while not all details are publicly confirmed. These types of interventions are typically used to define the waistline and create a more exaggerated, curvy silhouette. Information regarding facial procedures is more limited. There is no clearly documented list of confirmed treatments. However, based on visual comparisons, some observers have suggested the possible use of dermal fillers or other minor enhancements to refine facial features. These observations remain unverified and should be interpreted with caution. Lacey Wilde's transformation is widely regarded as one of the more extreme examples of repeated cosmetic enhancement. According to various reports, she has undergone approximately 30 to 50 procedures, with total costs estimated to range from $250, 000 to over $1, 000. This level of surgical activity has made her a frequently cited case in discussions about the limits of aesthetic modification. The most defining aspect of her appearance is her extensive history of breast augmentation. She is reported to have undergone more than a dozen procedures, increasing from an A cup to an extremely large size, often described as QQQ. At this scale, her chest has been estimated to weigh around 42 pounds. To support this, she has reportedly required specialized interventions, including an internal bra and the use of biological materials such as pig-derived tissue to reinforce the skin. Beyond this, her transformation includes multiple body contouring procedures. She has undergone Brazilian butt lift surgeries, estimated at 2 to 3 times, along with repeated liposuction treatments across various areas of the body. At least 2 tummy tuck procedures have also been reported, all contributing to a highly exaggerated hourglass figure. Facial enhancements have included repeated lip filler treatments, multiple rhinoplasty procedures, and other techniques aimed at widening the eyes and refining facial features. These combined interventions create a distinctly stylized, doll-like appearance. She has also reportedly pursued less common procedures, such as internal corseting, skin expansion, and body lifts, which are considered more extreme within cosmetic practice. However, her experience has also involved physical challenges. Reports indicate difficulty sleeping, often requiring an elevated position, and reduced mobility due to the size of her implants. Some surgeons have reportedly declined further procedures due to the associated health risks. So after everything you've seen, all these transformations, all these procedures, pause, yeah. The real question is, where do we draw the line? Chậm lại, hơi lạnh. Because at some point, it's no longer about looking better. It's about chasing something that might not even be real. Nat một nhịp. And the craziest part is, sometimes, what looks like extreme surgery is actually just makeup, lighting, and angles.